unethical for me to diagnose Zoro because he's not my client. No? And I have not talked to him. I have not really seen him up close and personal. So I wouldn't know really what the diagnosis of Zoro is from word of mouth. However, students say he has schizophrenia. By the way, Nika and Carla, the politically correct way of saying that person has a disorder is this. And you don't say schizophrenic, but you say person with schizophrenia. You don't say mentally retarded, but you say person with mental retardation. Okay, about Zoro, in Filipino labels would say is baliw, nasiraan ng ulo, kulang sa tornilyo, or maluwag ang tornilyo. But those are just labels for people who you see who is not functioning well according to your norms, right? Let me just tell you something about abnormal behavior. It's very difficult sometimes to consider our behavior as abnormal, especially when these are not based on diagnostic symptoms. But may I just inform you that for a behavior to be abnormal, it must be experienced as a dysfunction by the person. Dysfunction, that means na-affect yung kanyang social, emotional, and even career or occupational functions. Dysfunction. There is personal distress. Secondly, the person may experience pain. Personal distress. Thirdly, there is violation of norms. And the norms, of course, are given by society. So whatever we consider as a violation of that norms, we may say that that seems to be an abnormal behavior that is abnormal. Distress, violation of norms, personal dysfunction. These are the three of the most important criteria for behavior to be abnormal. Now, I think their focus in this interview is to find out what really is wrong with Zoro. As you can see him, he's walking around, running around. He does not really harm people. So, first of all, personal distress, painful. Wala naman tayo nakikitang he experienced pain. No? Secondly, personal distress, wala na yun. No? Thirdly, we say violation of norms. Meron pa alam mo naman, ang UP, liberated ang campus, and he doesn't really go to places where he's not accepted, I think. Unless some of you may say na nakita niyo sa Cubao or nakita sa Makati, wala naman yata. He just confined himself to UP and the environs, where people have already accepted him, more or less. The only thing that we can find in him that is kind of weird or unusual is his appearance. Have you ever talked to Zoro?
Once.
Once?
Yeah.
How did he sound?
Parang...
When you asked him a question, was his answer relevant to the question?
No.
Okay. Yan siguro tayo kaliwanagan na in schizophrenia is a disorder which has may masasabi nating positive symptoms and negative symptoms. Okay, papaliwanag ko. Doesn't mean positive symptoms are good. This is just a classification of the symptoms. Pag positive, may sobra ka na symptoms. For example, hallucinations is one positive symptom ng schizophrenia. I'm not saying Zoro has schizophrenia. We're just saying na kung mailagay man siya sa kategory ng schizophrenia, may dalawang simptomas, positive and negative. Wala pa sa picture si Zoro, okay? Now, sa positive symptoms, an example nito would be hallucinations, visual, auditory, even gustatory, or smell, na nangyayari sa isang tao na hindi naman nangyayari sa normal na tao baka. For example, may nakikita siya na hindi naman nakikita ng ibang tao. May naririnig siya. Okay. That's hallucinations. Another example of positive symptom, kasi pag sinabing positive, sobra, in excess of. Okay. delusions. Now, I think you have an idea what delusions are. Delusions may be thought. Delusions can be paranoid, na may nag-aabang sa akin, no? Or persecutory, na they're out to get me. Palaging may ano sa akin, gusto may pumatay sa akin. It might be grandiose or grandeur, delusions of grandeur na ako yung pinakamagaling, ako yung mga ganito. So, kung meron siya sa kahit madalawang symptoms lang, positive symptoms, for at least a period of 1 month, you may consider that a candidate for schizophrenia. On the other hand, dapat meron din siyang negative symptoms. Ano ba yung negative symptoms? Pag sinabi natin positive symptoms ay sobra and excess of, ang negative symptoms naman are lack of. So, meron tayong tinatawag na anhedonia. Hedonia, that is pleasure. Pag sinabing anhedonia, there is a lack of anticipatory pleasure, there is a lack of pleasurable experiences. Like when you say, ay, kakain tayo sa fiesta.